Alright, so you definitely don't want to develop diabetes in the first place. And if you do have diabetes, you definitely don't want to develop these 5 consequences of diabetes that could be very debilitating and cause early death, unfortunately. And this video is going to be an extension of my earlier videos on 9 symptoms for diabetes that you can catch early. So make sure you watch that video too. So I'm going to have this at the end of this video. Let's jump right into it because this cannot wait. I'm Dr. Khan and I talk about how to treat your diabetes naturally so you don't have to suffer any of these consequences. The first serious consequence of diabetes is something called diabetic retinopathy. So this means that the retina, the back of your eye, has some problem. This normally comes out with vision loss, blindness. This could lead to cataracts as well as glaucoma in your eye. Now, cataracts is when your lens starts to get white and you just can't see through the lens. And glaucoma is that when you have a lot of pressure in your eye because there's too much fluid accumulating in your eyeball. And that presses on your optic nerve, your vision nerve, and that leads to damage of that nerve and you can't see after that. Diabetes is the most common preventable cause of blindness. All right, what do you feel with diabetic retinopathy? Blurry vision, inability to differentiate between colors, fluctuations in your vision. You may be seeing properly, but then, you can't see much. Then you're seeing again properly, and so it fluctuates like that. You could have floaters in your eye, and you could be seeing things, and you're like, what the heck is this? Sometimes the first thing people notice is that you cannot see properly at night. You're having trouble driving your car at night. That could be a major problem. Now, having said this, how does diabetes actually cause you to have all of these eye problems? So when your sugar levels are high, your glucose, your sugar molecules tend to deposit into your lens. Now, the lens is the thing that you see, just like I'm wearing these glasses, it's helping me see. Now, when it is filled up with sugar, then it also brings in all the water along with it. When that happens, your lens swells and it tends to deposit in there, leading to trouble with your vision. Now, the next thing that happens is that just like you have a gut where when the gut becomes permeable, you can have a leaky gut. Same thing happens in your eyeballs where a sugar-related breakdown of your blood-retinal barrier gets disrupted. There's a break over there and there is leakage of blood as well as fluid. Thus, you have a leaky eye just like you can have a leaky gut. So diabetes is something that can cause you a lot of vision problems. Now, the next condition is called the diabetic nephropathy. Nephro means kidneys and pathy means disease. So you are going to develop a disease of your kidneys if your diabetes is uncontrolled for longer periods of time. So what happens over here? Your poorly controlled diabetes, your elevated sugar levels, they cause again damage to your blood vessels, leading to leakage within the kidneys. The kidney blood barrier gets disrupted and you have basically leaky kidneys. And the first thing we will notice in the hospital is that you are leaking protein into your urine. You will be eating protein and you will be trying to gain muscle and exercising, but all of your protein is actually going down your urine. Now, in the long run, you could tend to develop kidney failure. That basically means you may need to be on dialysis or you need a kidney transplant. Somebody needs to give you their kidney so you could operate properly. Along with leaking protein into your urine, you could actually develop decreased urinary production. When you're unable to urinate properly, fluid accumulates all over your body. That could mean fluid could accumulate into your lungs, into your stomach. And the other thing happens because kidney is a filtration system in the body that your toxins tend to accumulate. That could lead to problems such as itching, burning sensations, nauseousness. All these symptoms can be very debilitating. So my friends, a high sugar level or persistently high uncontrolled diabetes is not benign. It could cause a lot of problems and a lot of distress for yourself as well as your family because these symptoms happen earlier in your life, in your 40s and your 50s, and your lifespan and your health span could unfortunately be cut markedly. The third long-term consequence of diabetes is something called diabetic neuropathy. Again, neurons, your nerves, and pathy means disease. So a disease of your nerves and neurons. So this is one of the most common signs of diabetic disease. And I talked about this in my 9 early symptoms of diabetes as well. But I am going to mention this again here because it is so important. Initially, you will develop tingling and numbness of your feet and hands. Later on, what's going to happen is that you're not going to feel anything in your toes. And even if there's a rat that is biting off your toe, you won't feel it. So that is how bad this could get. And then slowly but surely, we doctors have to keep on cutting off portions, one toe, then the second toe, then half of your foot, then the whole of your foot, then some part of your leg, then all the way up to your knee. This happens continuously, and we are cutting off your limbs slowly and steadily. This is not a pretty sight. Some people may have altered pain sensations. They may be feeling pain, excruciating, bad pain by somebody just touching or some cloth just grazing your leg, your foot. My friends, this is truly miserable. Then the fourth late symptom of diabetes is gastroparesis. This basically means that your stomach is not able to do its job properly. Normally, you are not aware that your stomach is doing a really good job. It performs an amazing job of digesting and grinding your food and then moving the food into the rest of your intestine. With gastroparesis, your stomach loses this ability that you are not even aware about that it is doing. Now what happens? You get vomiting because your stomach is not able to pump the food out. You get nauseousness, abdominal bloating, your stomach gets big. You have pain in your stomach. You feel fullness even after eating just a few bites. You may be vomiting out food hours from after you had it. This can be really horrible, and I see multiple patients every single month, and this happens in type 1 diabetes and of course also in type 2 diabetes where people don't control their sugar for long term. Now, how does this happen? Similar to your nerves in your limbs being affected. And mind you, there are more neurons in your stomach system, in your gastrointestinal system, than there are neurons in your brain. So keep that in mind. And just like the neurons in your legs, the neurons in your legs also weaken up and they're unable to function. Thus, the digestive function and the motility function, the movement function of your stomach is destroyed. And the fifth long-term consequence of diabetes is heart disease, and people with diabetes are 2 to 4 times more likely than regular people to develop heart disease. Well, one thing is you may have chest discomfort when you walk or exercise, and this starts to get worse and worse and worse. Second is you may have chest pain, or you may feel tired or fatigued or short of breath with minimal activity. This could be troublesome. Then one thing to note is that you could generally have a heart rate, a resting heart rate that is greater than 100 beats per minute. Now, there are many causes of your heart rate being high, but if your heart rate is persistently high, you should definitely get that checked with your physician. And for some of the young men out there, if you are in your 30s, 40s, 50s, or you're in your 60s, or for young men or even middle-aged men, if you are noticing erectile dysfunction, meaning that your male part is not adequately working, that could be an early sign of you developing heart disease. Because just like in the heart, your vessels get tight, and if your vessels get tight down there and you're unable to perform actively in bed, then that could be a secondary sign of you are developing heart disease. So get yourself checked up. Although there could be multiple reasons for erectile dysfunction, but if you have diabetes and you are developing erectile dysfunction, make sure you get yourself checked, because that could be a marker, an indication that you may also have heart disease. Anyways, I did not want to scare anybody, but this is what we need to know so that we control our sugar levels, we prevent diabetes in the first place. And make sure you do watch my 9 symptoms for diabetes video. I'm going to have that right over here, so don't miss out. And this is what I talk about, guys. So subscribe to this channel over here as well. I'm Dr. Khan. Thank you so much.